Committee on Education and Labor will come to order, and I want to welcome everyone to the hearing. The committee is meeting today to hear testimony on examining threats to workers with pre-existing conditions.
Every person in my community has a loved one who would be affected if the Affordable Care Act was threatened. Every single person, including me. In my case, it's my little brother David. He was born 10 weeks premature, less than 2 pounds when he was first born. Spent the first 2 years of his life in and out of a hospital. Came out with a health care bill 104 pages long. And because of that, he'd be without insurance until he's 65 and on Medicare if we did not have protections for folks with pre-existing conditions.
Earlier today, along with Representative DeSaulnier, my Democratic colleagues and I introduced my first legislation in Congress to overturn the Trump administration's rule expanding junk plans. Insurers should never have the option to discriminate against patients with pre-existing conditions. So Dr. Gupta, can you tell us more about why they're called junk plans and what kinds of consumer protections can junk plans exclude?
Well, thank you. I think part of what's important is not just the pre-existing conditions protections, but also the affordability as well as the accessibility in terms of essential health benefits. So none of this is covered or required to be covered in the short-term plans or also as we term the junk plans.
If the ACA is invalidated in the Texas court, it will wipe away some of the protections that your constituent has benefited from. So, for example, in the group market, if she's buying as a small business owner, she could, or her employees could face what are called pre-existing condition exclusions, where the insurance company excludes from your benefit package those services that would actually treat your condition for which you actually need services for up to a year. So there are a number of critical protections that people in job-based coverage would lose.
It's scary because you know that without that care or access to that, without access to the coverage that will give you that care, it will be much harder for you to stand a chance. And not just for me, but for others with CF or with other pre-existing conditions that face those same struggles. It takes a toll not only on us as people, but also on our families.
We take a constitutional oath to protect the safety and the well-being of the people that we serve. So thank you so much for sharing your story. And I will tell you that you have people here in Congress who will make sure to constantly center that. So thank you. I yield back.